honor that I welcome you all to this esteemed seminar on present fevers, challenges and solutions. With the purpose of this meeting is to prevent citizens suffering in short term and long term, brief introduction of the fever, its prevention, treatment and post-fever care. All of us work as a team and collaborate wherever possible to achieve the objective of healthy citizens, happy Telangana. Today, we gather to engage in a thorough examination of the ESI system, seeming to enhance our understanding and address the complexities that it presents. We are privileged to have with us Shri R.V. Karan IS, I think is expected, Shrimati Prashanti ji IAS, Director, Department of Ayush, Government of Telangana. We also have with us esteemed doctors from Allopathy and Ayush, whose knowledge and insights will undoubtedly contribute significantly to our discussions. We anticipate a series of insightful presentation and discussions that will provide valuable perspectives and practical guidance. Thank you for your presence and participations. We look forward to productive and enlightening session. Thank you.
Guest of honor, Shrimati Prashanti IS, Director, Department of Ayush, Government of Telangana. Most esteemed panel of doctors, Dr. Rakesh Sahay, Dr. Sunil, Dr. Jagdish, Dr. Prem Sagar, Dr. Lakshmikant, Dr. Bukhari, Dr. Nag Lakshmi, Dr. Sridevi, our dynamic President Surajji, Vice President Maheshwariji, our past President Rajuji, our Managing Committee members, Health Committee members, guests, media and friends, a very good evening to all of you. The presence of our guest of honor, Prashanti Madam, shows her highest level of commitment, care and concern for the health care of our citizens in our state. So is true for the experts and the doctors. May I present a small couplet in honor of our guest of honor and the doctors. Friends, तारीफ के मोहताज नहीं होते हैं लोग, तारीफ के मोहताज नहीं होते हैं ये लोग, क्योंकि फूलों को इत्र लगाया नहीं जाता, as we cannot make flowers fragrant by applying the perfumes on them. Our today's guests are beyond and above any appreciation. Can we have a big round of applause to welcome our guest of honor and the panel of the doctors here. Friends, I also appreciate the presence of each and every one of you. Professor Bijon Mishra is with us, Dr. Taparia ji is with us, and all of you are here, who shows that all of you are health conscious. Today we have got the best of the officer, best doctors and best participants. Friends, as you know that many fellow citizens are badly suffering with fevers like chikungunya, dengue, malaria, typhoid and many other viral fevers. The hospital beds are full and overflow. They are overflowing. Friends, I have a question for you. Today, what is our biggest enemy? What is our biggest enemy? There is nothing right or wrong. If anyone would like to share, what is our biggest enemy? Death. Right. Big round of applause. Our friend says death. And friends, the biggest and the only enemy is people suffering. all of us, we are very privileged people. So here, the biggest enemy of us is people suffering and, friends, untimely death. Everyone comes to the planet, he has to go, but untimely death. So only the enemy is people suffering and untimely death. The purpose of today's seminar is, one, to address the suffering of you, your families, our people and our citizens in the short term and long term by prevention, by treatment and post-fever care. Long term means the number of such fever cases must be drastically reduced to 20% by the next year. Number two, as many people are badly suffering, so we must also think and act fast to avoid these sufferings. We must get united and fight only with people suffering and untimely deaths. Third, we must believe that if it is not patient-centric, if it's not easy, if it's not accessible, and if it's not affordable, then it's not a health care. Fourth, friends, we are very confident that Telangana would become the first state in India to disassociate health care its citizens enjoy from the wealth and income of the person and would make it in the next 3 years or so. Friends, with the presence of the person like Padma Shri Dr. G.N. Rao, founder L.V. Prasad Eye Institute and others in Telangana, with the presence of health conscious persons like you, with the presence of the best doctors and experts on the dais, and with the presence of the most committed and dedicated officer like Prashanti Madam, we must be able to work in a very strong team of Sarkar, Sanstha and Samaj. Sarkar, Sanstha and Samaj to achieve our goal of health for all and healthy citizens and happy Telangana. Now, I'd like to conclude with another small couplet. हार होती है, हार होती है, हार होती है जब मान लिया जाए, हार होती है जब मान लिया जाए, हार होती है जब मान लिया जाए, बट जीत होती है जब ठान लिया जाए, So here, acceptance of defeat versus determination of winning. So our determination of winning must be bigger than our acceptance of defeat, and all of us should take the resolution that we are determined to win. Now friends, we are eagerly waiting to listen to all our top experts who are present on the dais. I thank all of you. Good luck and goodbye. Thank you.
Informative for all of us in terms of, because we are all going through this problem of the surge in incidence of fevers in our city, and today I think this is a common occurrence in this time of the year when the monsoon is ongoing. We often have a surge in the incidence of fevers, and today we have gathered here to discuss about this because fever, as we say, is a response of the body to any inflammation or infection, and when it goes beyond a particular stage point, then we are worried about it, and we investigate, and we are looking at the cause of that and trying to go for a treatment for that. So what I would like to do in the next 45 minutes or so that we have is discuss about the various types of fevers, try to ask our experts, because we have a panel of experts here, how they would evaluate fever, what are the things that everybody should know about fever, because we get panicked by hearing about fevers like dengue fever, malaria or chikungunya, and now we are hearing about monkeypox and many other problems that we are hearing of. So whoever develops fever becomes worried that whether it is any of these serious problems. So just to give an idea, if you look at the present surge in fevers, today I was looking at the data from Fever Hospital. There are at least about 500 to 600 patients presenting every day with fever. They are being seen every day and being evaluated in our hospital, in Osmania General Hospital, because we have a mix of all the disorders. We have a lot of people coming with surgical problems, medical problems, all the non-communicable disease. So our fever numbers are to the tune of about 100 per day we get about 100 patients, about 50 patients coming to the 50 to 70 patients coming to the outpatient on the average, and about 10-15 requiring more detailed evaluation. 10-15 of them getting admitted every day with fever, and out of that we find that only a small percentage have these significant problems that we are speaking about, dengue or malaria. Doctor, so I would like to start off by asking about the more severe problems. I would like to ask Dr. Prem Sagar about a brief idea about, to give us a brief idea about dengue fever. What is this? How do we identify this? How do you diagnose? And some aspects about the treatment of dengue fever. So he'll just give us a brief outline about dengue fever. Yeah.
Fever, what we see. So fever is a very common symptoms what we see in the patients, and the patient comes is very worried. So what is the fever? So fever is caused by many diseases. Can I have my first slide, please? So what is fever? Fever, when we record the temperature, oral or rectal, that is more than 100 degree Fahrenheit, then we call it as fever. So fever is a normal process. Whenever we get infection or any inflammation is there in our body, it is a reaction of our body to protect ourselves. So it may be a reaction of body to an infection or any inflammation. So we'll see what are the causes of fever. Fever is caused by many things, like not only by infections, any bacterial, viral or anything. It may cause due to severe trauma, any body injury or any brain stroke or any autoimmune disease like many autoimmune what we see. Then we have many patients may have cancer also. It is a manifestation of cancer also sometimes, or maybe some endocrine disease like hyperthyroidism. And after taking, we see DPT children will take IM injection. They will get simple fevers for 1 or 2 days. So background of the disease process, we have to see what is the background, why he has developed the fever. Then we can go about to see. So in next diagram, we'll see what is the diagrammatically. Common causes, what we see, viral infection, any sinus, any chicken pox, malaria, pneumonias, UTIs, any sexually transmitted disease, skin infections, boils, or some certain medications, or severe dehydration in gastroenteritis, they also get fever. So we have to be careful what is the cause of fever. Fever is not only due to infection, we have to keep in our mind. So fever may be due to what are the infections. Commonly infection is caused by bacteria, then virus, then parasites like malaria, then fungal infections. So out of this, what we are concerned more today is about the viral infections. So viral infection, now burning topic is the dengue fever, chikungunya, monkeypox or mpox, or rare disease like Nipah, Zika virus. So today we'll restrict to what are the common we face in our day-to-day practice. That is dengue and chikungunya. We'll more focus on that. So dengue is a fever which is caused by a small organism, that is called virus. So virus, when they enters the body, then the patient will have dengue fever. But how the patient gets the dengue virus? Dengue virus is transmitted by the mosquito bite. So it does not spread from one person to person by contact or handshaking or sharing food or like that. But the culprit is the mosquito. So here we have to keep in the mind that we can control the mosquito, but we cannot control the virus. Virus is a very minute organism, we cannot catch it. But we can catch the only mosquito. So we have to focus how to control the mosquito spread, how to control the breeding of mosquito, how to control the multiplication of mosquito in our environment. So that should be the focus to preventive aspects. So virus, it will spread by only the bite, by mosquito bite. So that we have to understand. So here just diagrammatically it's showing that a mosquito has bitten one person and it bites 2 or 3 persons. If the person is infected with dengue, it will suck the virus from this infected person and it will bite again to the other person, so that other person will dengue fever. So this is the process of transmission of dengue. So dengue spreads only by the mosquito bite, that is Aedes mosquito. So what are the symptoms? So the symptoms usually is, one is a high grade fever, that is the patient will have headache, pain behind the eyes classically, they will have nausea, vomiting, swollen glands, joint pains and rash. So these are the symptoms what we get. As the patient gets severity, what we'll see.
Fever is because of these mosquito bites and the Aedes aegypti mosquito, particularly when it's carrying this virus. then it causes. So how common is dengue fever? If you are looking at our data right now today, what we are saying is that out of all these patients who are admitted with fever, we are saying, say, if we are seeing 100 patients, we are admitting about 10-15 of them. So about 3-4 of them actually turn out to be positive for dengue. So it's not that everybody has dengue fever. It is that a small number have dengue fever, and a smaller percentage of them go into the severe ones. Many of them are milder versions. They just require some supportive care, fluid replacement. Sometimes they may require to be hospitalized to get adequate fluids, and they respond to the medications. And some of them have low platelet counts and they require platelet transfusions, and they may require a more extensive treatment. So that is dengue shock syndrome, particularly what is spoken. So those are not very common. So important message is that they are not very common, but the important thing is that we can prevent this. We need to look at water accumulation and prevent this sort of thing. So these measures are probably very important from whatever fever we are looking at, as we see from all the other speakers also. But we'll move on to learn a little more about chikungunya from Dr. Sunil Kumar. He'll tell us a little about this chikungunya fever, how it presents, and what should be the features that we should look out for. And
Dr. Prem Sagar made my job easy. So because same duplication, so I don't want to repeat and bore much, because fever in fact it's a protective phenomena for the body, for ourselves. A fever, we'll know something is wrong in our body. Accordingly, we will react and we'll take treatment. Fever, it can be due to simple viral fever, a day or two. It can be due to high dreadful cancer also. So fever can be due to anything. So chikungunya. So chicken is nowhere related to chikungunya. It's a wrong notion in the public once upon a time, especially in year 2008. There was a rapid epidemic in chikungunya. At that time, sales was also chicken shops very less. So nothing is, chicken is nowhere related to that. So it's a mosquito-borne viral disease. It's a chikungunya virus, RNA virus. It's first identified in Tanzania, and outbreaks first appeared in Thailand and India in 1967 and 70s. After that, it spread to so many countries in the world. This is in the last 1 year, is the global burden in the worldwide. So India, South America, and Bangladesh. This is the mostly affected countries in the world. So coming to transmission, as doctor said, it's mosquito-borne disease, comes by mosquito bite of Aedes aegypti and Aedes albopictus. And mostly these are developed through the water-containing pots, shells like this, as doctor said. These are the two mosquitoes which can cause chikungunya fever. It's a mosquito-borne disease, same as dengue fever. So when to suspect? As any viral fever, it comes with a high-grade fever, chills, headache, and joint pains, muscle pains, and shivering, and rash, and joint swellings. This is the common for any symptoms. In severe disease, they can lead to brain infections and even jaundice, kidney failure, something like that. So coming to rash, around 10% of patients will be having rash. This is spontaneous recovery after 2 to 3 days. This is the typical rash seen in chikungunya patient, which is seen on the nose. It is seen after 4-5 days of recovery. So rarely this can lead to severe form of the disease in patients who are having comorbidities like diabetes, hypertension, elderly people, chronic kidney disease patients, and patients who are having lung problems. So rarely it can lead to complications like infection spread to brain, which is lead to encephalitis, like and it can cause some eye problems like red eye, and it can cause decreased vision. And rarely, and the main concern is for chikungunya is joint pains, chronic arthritis. after a fever, the joint pains, some percentage, around 14% of patients will be having joint pains. And how to diagnose? So 500 to 650 and up to 3 grams, we can give up to 3 grams in 24 hours. And cold sponging whenever required. And the important thing is avoid painkillers. So like brufen, aceclofenac, diclofenac, meftal. So whenever patient is having high fever, chills, if you go to a medical shop, that fellow will give aceclofenac or combiflam or diclofenac. That should not be done. That's a very wrong concept. It can lead to complications. So have adequate intake of fluids like water, coconut water, buttermilk, juices, whatever it is. Have plenty of fluids. Hydration will reduce the temperature and whenever required pantoprazole, something like that. And for rash, any antihistamines like cetirizine. And for joint pains, we have to give cold compressions like cold compressions for painful joints. Hot fomentation should be avoided. It can worsen the symptom at times. Avoid self-medication like steroids, antibiotics, self-medication, antibiotics, and other painkillers especially. And avoid aspirin also. It's rarely, as I said, severe disease. Very few patients will be having severe disease like intractable joint pains, altered behavior like brain infections, and decreased urine output, bleeding manifestations like bleeding beneath the skin, like skin rashes, severe rashes, and bleeding gums, bleeding in the motion, and jaundice. And this is the important one, chikungunya arthritis. Post chikungunya, around 14% of patients will be having chikungunya arthritis. It's a common joints. It can be joints, pain can be few weeks to few months. It can be up to some 1 year, 1 or 2 years also, very rarely. And most common joints are ankle joint, knees, hips, wrist, elbows, and small joints of the hand. These are the various joints which can be affected. And currently there is no vaccine. It's still under trials only.
Joint pains are a common sequelae that we see. Sometimes it starts off during the fever itself. Sometimes after the fever subsides, the pains persist for quite a few days, quite sometimes weeks and months also sometimes. So that can be troublesome in many situations. But important thing that both of them were telling us that hydration is very important, taking adequate fluids, avoiding all the NSAIDs, but taking simple paracetamol. That is the important message that they're given. And certain investigation may be required whenever we have more severe disease. We'll ask Dr. Jagdish to tell us something about the other fevers. He'll just give us a...
I just put this slide which is very important. Humanity has but 3 great enemies: fever, famine, and war. Of this, by far the greatest, by far the most terrible is fever. This is quoted by William Osler. See, that is the importance fever was given from ages. And even my teacher, Dr. Vimal Rai sir, used to tell, if you want to make any doctor humble, send him a case of PO. Seriously. Pyrexia of unknown origin, that you don't know the reason of fever from beyond 1 week, you send it to the case, that brings me fever. So what is the terriblest of the fevers? So we had lot of fevers, dengue, chikungunya. The biggest fever currently is the fever of fever. Not joking, because of late, after COVID, the amount of people walking into OPD with a bunch of tests, that is the biggest fever currently. So I have to tell them, you're okay. Don't go with that highlighted reports, you're okay. This is my in and out practice. So to be honest, today if a clinician, I mean to say a doctor who diagnoses with only symptoms, so that is very important. And the most important, see, I have to write on my prescription, take rest, very costliest prescription. Oh, I'm not joking, sir, I'm not joking. Take rest, hydrate yourself is important, because people are not doing this and they want their viral fevers to settle down. So viral fevers is nothing but it is an infection which has invaded when your immunity is low. So when is your immunity low? Maybe you are stressed out, maybe you have traveled more, maybe you consume something which is infectious. Our body will take time to heal it, but you're not allowing that because you don't want to give rest. You are in hurry, rat race. We are rat racing. Come on, we want to earn more money. We want to impress someone. This is the biggest flaw happening, and that is spoiling the healthcare currently. The other thing is diagnostics. So I call it as OCD, obsessive compulsive diagnostics. People are obsessed to do tests because healthcare in India is so cheap, so cheap. In Western world, a doctor's consultation you can't even get for 1 month if it is not an emergency, and you have to bloody shell down 20,000, 25,000 for consultation. Trust me. I know people who run from UK only to show their reports here. Yes or no, sir? This is what I see in lot of people.
It is vice versa now.
Huh.
Previously, we used to send the report to US.
Sir.
No, they are.
No, they're coming because they have some abnormal report and they're worried. So the consultation in UK will be after 45 days. Now they're restless. So they take a ticket and come here and show it in something and they go back. So this is what, I'm just deviating the topic. Please allow me, because this is the biggest things what people have to understand. Don't go by your reports. Identify a good doctor and just go by him. That's, you're sorted. So nowadays everyone try to understand medicine. Please, you can't understand medicine. Have the logic, that's fine. But understanding medicine, that's very easiest choice is identify a good doctor, just go with him. So I'll just go by my slides. These are few of my, this is what I keep doing because I try to educate because I teach, I hardly see 20 or 30 patients a day. I keep writing an articles, at least people understand. Yeah, this is during those time, that dangerous duo. So this fevers keep changing, juggling every season. Is it dengue? Is it COVID? Is it malaria? Is it typhoid? Is it chikungunya? This year, I think sir was clearly telling chikungunya. I think this year, every year dengue was the Mahamari. This time chikungunya has dominated dengue as far as my experience in my OP is concerned. And the dangerous part about chikungunya is it's crippling the people. It's making you to sit on the wheelchair for 1 month, 1.5 months. I see my patients coming back even after 40 days. So the moment we wean off the steroids, they're again on the bed. So people understand. So you attending the right doctor in the right time. The key of today's message, right doctor in right time. You keep doing n number of tests. Trust me, there are n number of tests to confuse you, and at the end again your doctor, a good clinician who's going to take you forward. So the magnitude of unseen pandemic, yeah, my seniors have already spoke about those fevers. I don't want to emphasize each and every, but as a clinician, simple tips when we have to rush to a doctor, when we can manage in the home, and what are the simple things at low cost. See, if you ask me, I think the message is clearly conveyed. Viral fevers, there is no treatment. When I say there is, there is no medical therapy per se. Now, what is the treatment? Giving only basic paracetamol, taking good amount of water, rest and vigilance. When I say vigilance, under a good doctor supervision for 3 to 5 days. Over. The entire topic of viral fever is over within this 20 seconds. Again, I repeat that at the take-home message. So these are arboviral illness, very, very fancy terms. Yeah, dengue, everyone know. Chikungunya, Zika, I don't want to emphasize because no fevers except in social media, let us not discuss. Japanese encephalitis, yeah, in our current practice, 1 and 2 we come and see. But I don't want to discuss in public forums because one single word coming in a public forum, immediately next day that is a headliner. Then everyone break heads. No, rarest things let us not discuss because from ages we are taught communists are the first. Let us deal with the communist. So approach to fevers by physician. This is again and again. First plot the day of illness. So I repeat, every patient should able to remember their symptoms well. Please don't talk about, the moment I ask, sir, what is your problem? I have typhoid. Arre Baba, please tell what is. They directly come with a Vidal test. I have typhoid. Sir, again, sir, I want your symptom. Sir, creatinine is elevated. Half the time my frustration goes with teaching him what is a symptom. I can understand. This is all everyone, every day you are continuously brain fed with information, health information. This is health infodemic is the dangerous epidemic currently happening. Every day, be it WhatsApp, be it Google, be it YouTube. Now because we don't have regulations on healthcare information. This is other, because Prashanti madam is here. This is something which we have discussed. Dr. Srinath Reddy sir, who is PHFI president, last time when I was in AIG, so I have put up information, sir. I spent half an hour or 20 minutes for each patient. My diagnosis is over within 3 to 5 minutes, but 20 minutes I have to convince that I am doing right for him. Because I talk only 5 minutes, you Google, YouTube is talking every day for 2 hours. No, because this problem is healthcare everywhere. Everyone wants attention, everyone wants money. So I think a strict regulations can actually bring down the price of the healthcare in a big time, and a rightful education into the health, which has to be regulated only by government, not any private authorities. So assessing severity by vitals. So this very few things are important to understand. For example, dengue was discussed. Dengue, it's only 5 days to 7 days. Please don't tell me I have dengue fever from 20 days. Dengue is viral illness. It's a job of 7 days. After 7-8 days, someone is okay, then dengue is over. So people don't understand this. So you have to plot the severity. Dengue is high temperature for 4 to 5 days. After 5th day, temperature drops down. 5th day to 7th day is critical illness where your platelets drop. So our importance, the moment they say symptom, I ask from how many days. So we plot the disease course. Based upon that, every doctor decides how the journey is going to be, and we explain the patient. So most important is not your test, it is always symptoms. If there is a good patient, there is always a good doctor to tell the good diagnosis. The problem is nowadays we are not finding good patients. It is confused patients. Confused. Sir, in and day practice, please try to cut down my time, because I can talk hours and hours, because this is 16 years of our practice which have transformed. Previously we are clinicians, now we are diagnosticians, which are driven by patients' reports. So please understand, identify a good doctor, your job is over. Now good doctor, I don't know, someone who is honest, someone who is knowledgeable, and someone who is accessible. So other few important things. Good patient, that's what, sir. A good doctor comes only with you have a good patient. So the red flags of all viral fever, extreme deviations, that means they have very high temperatures, 104 not coming down even after day 3, and pulse is going 120, 130 continuously. Someone who's tachypneic and saturations are dropping, yes, that your doctor have to take the call for admission. Nowadays the biggest challenge, patient decides admission because he has insurance. Having an insurance is not criteria for admission. Today, most of the hospitals are flooded with patients because most of the admissions may not be required. He thinks that it is my right to get admitted. No, please. So these are very few things what people have to understand.
Yeah. So I think we'll come back to you again, sir.
Sir.
We'll. I think you have given very important messages about.
Last slide, sir. I'll close it off.
Yeah.
Yeah, I think lot of cells tests, again people get confused with the tests. Your tests have to be understood by your doctor. Don't get panicky looking at negative or positive. Tests have to be decided or understood or interpreted by the doctor. So doctors want to treat with 500, patients want to treat with 500 euros. So this is the problem. Please understand, give it an opportunity.
So I think, thank you. I think you have given a very good message that, you need to look at the clinic.
Not only dealt with the pandemic, way back 40 years back, we even dealt with polio endemic, and there are living examples with 10% of disability, and there is a history of dealing with infectious fevers, and everything is documented. So Mr. Agarwal was asking about who is the biggest enemy. The biggest enemy is the water, sir, because today we are going to deal with vector-borne diseases. And I have small presentation on this. We have to see what are the, this is by PubMed publications. What are the most influencing factors of these vector-borne diseases? One is changes in global populations and demographic, and we are all distributing from one place to every different country is filled with Indians or any other Chinese or Koreans, you know, we are completely distributing, and also spoil our health. And next, self-hygiene practices. So simple kriyas. You have to take bath every day properly and brush your teeth properly, then safeguard the home and be non-infectious. Means not spending much on chemically filled paints and, you know, excessive use of polyesters as a furniture, and using the personal hygiene does not only limit to your clean brushing and bathing. So the soaps you use for bathing.
Today, that is from March to June or mid of June or July, we are all underwent or experienced extreme heat. After that, showers brought the temperature down, we are all happy. But that too only momentary, isn't it? And later on what happened? We had a gamut of various diseases, which we call it as tropical diseases or monsoon fevers, right? So in fact, when compared to Western countries, these diseases are very much here, whereas in Western countries, as the climate is very cold, temperate, so these diseases are not seen much. So my earlier speakers have spoken about chikungunya, then dengue, etc., and they have made my presentation very, very easy, where they talked about various preventive aspects of these diseases. I would like here to focus on homeopathy, right? Many of you are aware of homeopathy or not, I don't know, but you see, what is homeopathy? Homeopathy has come into existence in 1796. The founder is Samuel Christian Friedrich Hahnemann. He is a German physician, allopathic doctor. He was not happy about the prevailing treatment there. So what he did is he started translating.
Ayurveda has focused more on the preventive aspects always, and the definition. Okay, na? So shall I continue? Okay. The definition of Jvara or the fever in Ayurveda is Dehendriya Manastapi Sarva Rogagrajo Bali. Here Deha means the body, Indriyas or the sense organs, and Manas is the mind. That which causes pain and unhappiness to all these three is considered to be Jvara or the fever, and it is supposed to be the head of all the diseases. And it is full of strength. As said in the definition, in the same way, Ayurveda dealt extensively about the fevers. And coming to the preventive aspect, Ayurveda advocates two regimens. One is Dinacharya, that is to be followed on daily basis. And the second one is Rutucharya, that has to be followed. The second one is Rutucharya, that is a seasonal regimen. So I'll go with the seasonal regimen. We have 6 Rutus, like Shishira, Vasanta, Grishma, Varsha, Sharat and Hemanta. The total calendar year is divided among these 6 Rutus, 60 days comprising of each Rutu. So we have a fixed protocol that has to be followed in each and every Rutu so that the immunity or the health of the person will be preserved.
He has dwelt upon the Unani concepts of management of fever. So coming to the Unani system of medicine, as everybody knows, I hail from Unani system of medicine. I am working as a professor at Government Nizamiya General Hospital, that is near Charminar. Unani system of medicine, the basic is the body is made up of 4 humors, that is blood, phlegm, black bile and yellow bile. And the founder was the Hippocrates. And what he said was, because before Hippocrates, it was the Jadoo, or it was something satanic verses and all these things, it was prevailing before Hippocrates. So Hippocrates formed a theory of humors. And as per our concept, that is Unani system, if these 4 humors are in a ratio with each other, if the ratio is good among...
As such, there is no approved vaccines for dengue or chikungunya. Still, it's under research only, under development.
For influenza vaccine, would you like to speak about the
Yeah.
influenza vaccine?
So there is a adult immunization. Is a topic called adult, like children, as we are giving infants, children immunization. There is adult immunization also. Actually, there is lack of awareness in India, in developing countries. It's a very well developed. It's a routine program in Western countries, developed countries, like H1N1 influenza, pneumococcal vaccine, and varicella, herpes zoster vaccine. These are adult vaccines, which is very useful, especially for elderly people, 60, 65, with comorbidities like diabetes, hypertension, and other any cancer people, heart, lung problems. Such people, they definitely require this vaccination.
So the influenza vaccine has to be given yearly because you have different strains coming in every year. So you may require a vaccine every year for preventing influenza, particularly useful in elderly individuals, particularly if they have any of the other problems like diabetes, heart disease, and these people who are susceptible to infections, they may take that. And in some, maybe in diabetics, there may be need for even pneumococcal vaccination may be a good option to prevent these infections, because community acquired pneumonias are common. So I think with that, we'll just ask one question, Dr. Prem Sagar, about, we've been hearing about monkeypox. Would you like to tell us something about this? Because recently in the news also there was some, so everybody wants to know a little about what is this monkeypox and how should we, what should we know about it?
Actually, monkeypox is a misnomer. It does not, there is no relation with the monkey. It is usually spread by the small squirrels and the rodents. So it is basically found in the African region only, but it has been imported. It is similar like smallpox, what we have seen in olden days, smallpox. The rash appears like water bubbles on all over the body. It usually spreads with this common contact or some respiratory droplets. And the treatment is just symptomatic treatment. We have to give oral hydration, control the temperature. And it is a very rare disease, and it is usually seen in who works in the farms, who take care of animals, or in the forest they are going about. But in India it is not to be seen, but in African countries. As now there is no epidemic or any warning for mpox in our part of the country. I think is very under control, and not to be afraid of that, sir.
Still, it's in.
Only one case. One case
Still,
is there, but
so one recently, 2 days back, one confirmed case was found in Delhi.
They came from Africa.
Yeah, they came from Africa. Still not yet, only one case. Any family, any history of travel from African countries or American countries, even in Europe, with history of fever, rash, like water bubbles, as Dr. Prem Sagar said, we have to suspect.
So any questions from the house? Yeah.
Nowadays we have lot of pets, but do you think any communicable or zoonotic diseases directly coming? So far the fevers which we discussed are not zoonotic. Yeah, when you talk about, there are some rare diseases like cat scratch, brucellosis. So these are certain feline fevers. But one have to be very, very vigilant when they commit for the diagnosis, because again, as I told, none of these fevers are not the high index of suspicion from day one. So the pattern of the fever and symptomology is the crux for any doctor or any clinician to identify. So as we say, it's always history taking. If after 3 days or 5 days the fever is not as common as the other, then we have to go into the deep of the history. Is it, do you have a pet? That the pet has any symptoms? And is this the similar symptoms in the family is what we notify? Then definitely beyond 5 days, our way of investigations are different. First 3 days, most of the doctors, you need not test beyond CBP. But unfortunately, day one, as sir was telling, 6 hours people want tests. No, please, tests don't give us. And as you told, healthy pets, unhealthy pets. So if you are getting a disease from a pet, first of all, identify whether your pet is unhealthy or not. So definitely there are, because now mammals, any mammal can give a communicable disease, provided is it healthy or not.
Yeah. So the message is that keep your pet healthy as you are keeping yourself healthy, and vaccinate your pet also, so that you don't get any disease. Yeah.
Over the counter you cannot take. You should take from a doctor, qualified doctor.
So we have to get a prescription.
Not prescription, we have to come to a doctor. So just like for a child, for vaccine, you need to go a healthcare provider or a pediatrician. Like that, you need to consult a physician. Like a flu shot, yearly flu shot. It's a common practice there.
We have got tests, rapid tests for each of these, and then some people are working on a panel where you have all of them done on one panel, one drop of blood. That is what is being done in our hospital, also in our medical college. They are working on that. So they're taking one drop of blood, looking at the entire panel of antibodies and antigens, and you'll know all of them in one test itself. So that is also being sort of developed.
So how long does it take to get the result?
It gives it within a few minutes you get that. The message is that there are other different types of tests available, and we may have to use it judiciously. It is a long subject. I mean, as Dr. Jagdish has said, that we should go by the decision of the treating doctor of what should be the test to be done.
Yeah. ELISA test result takes how long?
As Dr. Taparia
6 to
said,
8
it may be
hours.
about a few hours, 6 to 8 minutes.
We
Madam is
have
going to
a
speak
Government
about
of
that.
India website,
One
sir.
interesting observation, now that you talk about prevention. I happened to be collector of a district for about 3 years, and in the rural areas, mosquito is a perennial problem. So we had something called dry day. So that was a day within a week where you don't use water for watering plants, and you dry everything around your house. It could be a tire, probably accumulating water or something like that. So that's a dry day which cuts down. Those eggs don't hatch. So that was an interesting that we tried, and I felt it worked. So we could do it in our organizations also, could have a dry
I think
day.
you should.
So that day, typically you cut down all water supply to all small things.
The best part of this outcome of this discussion should be that what you take back to the communities, right?
Exactly.
Around any buckets or anything, small ponds, we can breed gambusia fish so that it will eat away the larvae.
FTCCI for this really enlightening session. This is something which should have been taken up by government, like this gentleman has just said, because we need public debates like this to control, because we are the ones who are facing the brunt of this, because all our PHCs and all, we have crowds, people coming in, and with a lot of diseases like all the streams of medicine have just informed. So this season sees the rush of diseases all over, and many of them may not be as critical as perhaps chikungunya and dengue. I believe 90% are just pure flu cases, but they have to be handled nevertheless, because people are afraid when they have running fever and they probably rush to clinics, and of course that whole system of diagnostics, taking medicines and all that goes on, but most of them may be just flu. And here actually I wanted to also probably have a debate on that flu vaccine. I don't know about the government hospitals so much, but all corporate hospitals, we also have a representative from KIMS, all corporate hospitals prescribe flu vaccines now, even in India. It's there. I mean, it's just, you needn't even ask for it. It's just prescribed as a matter of fact. All kinds of vaccines are there now in the market. We don't know if it's a vaccine war or if somebody is interested in it, but nevertheless, the flu vaccines there. And I wanted to, the debate to also dwell a little on whether these flu vaccines really work. Considering the hundreds of different strains that you have of flu, do these flu vaccines really work, especially for children and all? 1 year, even if it's for a year, will it work for that year? Because you have so many strains of flus. That's what I wanted to know. So that could be an interesting area. And I would really like to also congratulate the Singhan sir and Shekhar Agarwal sir for having so many different streams of medicine on this platform. That itself is a challenge. That itself is a challenge, because I happen to be working in this Department of Health. I can see the hostility between different streams of medicine. Having them all on this platform itself is a challenge which you have really achieved, because exactly, you have done it, because I know that this kind of innate hostility exists between the different streams of medicine, because you have probably been drilled in that for years, after your 5.5 years of curriculum, and then you are into that stream of medicine, and usually one is hostile towards other streams of medicine. But I am an advocate of integrative systems of medicine. I should be so. I should be so also because I am the director of Ayush in the government. And why not? Why should we not take the best parts in each stream of medicine? For instance, in India, when you talk of Ayurveda, we have them for hundreds and hundreds of years, probably even thousands of years, and something has come out of it. And there is so much literature and knowledge gone into it. So why don't we have some takeaways from that? So why don't we open our, doors in our brain to even these streams of medicine? Let us take a bit of it. For instance, you have diet therapy. Diet therapy is a very important part of naturopathy. And why not? You all know we need to have a particular diet when you have a particular illness, like you have today in Apollo. You have a dietitian. So a dietitian will come from the naturopathy stream of medicine. Similarly, physiotherapy is prescribed everywhere, and physiotherapy is also a part of our stream of medicine, other streams of medicines. And of course, there are certain diseases, because I have closely associated myself with these different streams of medicine. There are some particular diseases which I feel are very well cured, say in homeopathy or Unani. A few, maybe some, a particular kind of psoriasis, for instance. I have myself seen it being cured in an alternative system of medicine. So why not? Why not we take the best aspects of all kinds of streams of medicine and try to have an integrative system? I'm not saying do not be loyal to your system, but let us not close our doors to all other systems of medicine too. And today, that way, I think the audience will agree with me. It was very enlightening. Going into the aspects of how probably the Unani system of medicine works, or allopathy works, or your homeopathy and all these systems work. So that way I really thank this department, this organization for having this very enlightening and very interesting debate today. And and all have participated in a very enlightening and very animated manner. Everyone has discussed with no criticism and as such. So I really encourage that. I really encourage that. So you are, in fact, the government of India also, the present government has been very supportive of traditional systems of medicine. In fact, they have been trying to organize some kind of a training for different systems of medicines in different areas. For instance, the allopathy system of medicine have been asked to get trained into traditional systems of medicine for a month or so that you can have an idea about what it's all about. And similarly, those who are in other system of medicine, and I don't know, many of you may not be aware, but this curriculum that we have for, say, bachelor in Ayurveda medicine or by a bachelor in Unani medicine, that is also a very rigorous curriculum, which is also the same number of years that you have for, say, an MBBS degree, 5.5 years of lot of work goes into it. So it's not as though we can just, put it aside saying that it's not worth it. So let us all be have an open mind from that point of view. And as fevers go, so hopefully I think things will come down. And will this be seen in some social media or something? Are you streaming it somewhere? Later at least, it is a recorded version. Because I think it will be quite useful to the public, and a lot of people will enjoy today's discussion. So once more, I thank all of you for inviting me here, and it was really enlightening. We could have gone on for hours, but then I think at some point we have to call it a day. So thank you again, all of you. I was really impressed by Dr. Jagdish, and like you said, all kinds of things. But I must tell you that I think AI and the information revolution has come to stay. Whatever you say, okay, today we are all Google doctors, but it has come to stay. I cannot stop myself from seeing it, and I don't think it's all so bad as probably you doctors see it, because now you see people coming and arguing with you about particular streams of medicine, but it has made us knowledgeable, and it has also helped us. Because sometimes if I have a particular symptom, and then I'm not talking about myself or this particular case, but we do look up and we are knowledgeable, more knowledgeable about it. And nothing wrong in making the entire world knowledgeable. It's not, medicine is not something which is only private to the doctors. So it's now an information revolution, and in the future also, I think AI will be challenging not just doctors, but lawyers, Chartered accountants, all kinds of professions. So it's come to stay. In the next 100 years, I don't see such a big role for doctors. It's all going to be information everywhere. And like you said, one drop of blood and you'll have probably all the diagnostics right in front of you, even in your mobile phone. So you'll know what it's all about. So that has come to stay. So let us all open our minds also to that. And yet with a grain of salt, like all the doctors have just said. So with this, I think I'd like to end today's talk and thank you again for inviting me.